welcome to another one of our live chats. So today I am joined by Thomas Wilke and Nils Picker, and we will be discussing one of our core services at GPAM called Strategic Consulting. So could you both please introduce yourselves and briefly describe your roles at GPAM?
Yeah, Nils, go ahead, please.
Yeah. All right. So, hi, my name is Nils. I'm a project manager and senior research consultant at GPAM. I'm mostly specializing in building market access strategies and real-world evidence generation. I think on a basic level, my role involves a mix of project management, data synthesis, and analytic skills, but always with a goal to develop actionable recommendations with a primary goal of helping our clients in navigating through a complex healthcare environment by generating and interpreting real-world evidence. And yeah, with my background in economics, I mostly was drawn to a role in consultancy in healthcare due to the fact that data plays a big role here in decision making, and it's really interesting to shape processes like health technology assessments with data, which ultimately informs therapeutic value and reimbursement policies.
Right, you sound very busy then, Nils, doing all of that.
And
Thomas.
He even forgot one thing, but I will mention it. So my name is Thomas Wilke. I'm scientific lead at GPAM, so leading the scientific, both external and internal projects. I'm also a professor at a German university. And yeah, I mentioned as we will talk about that today, as we had about 1.5 to 2 years ago, the idea of developing a unique tool for strategic evidence generation planning and associated processes. Nils was the first victim, I would say. So he is responsible for development and implementation of that tool, and also talking to the programmers in our team. So to develop or to implement abstract ideas we have and develop them in a way that a tool that really works includes these ideas. So that's his role as well.
Great, thank you. So I've always known for a while some variation of Thomas and Nils working together, but maybe you could tell our audience, how long have you both worked together, and how important do you think it is to have these long-term relationships within a company?
Mm-hmm.
Yeah, maybe I begin again. So I know Thomas.
Ideally, it should be one number. In terms
Let's
of
see if you both have the right number.
But maybe you feel it that it was longer than it indeed was. So I don't know.
We'll find out.
I think it's a bit more than 7 years now. So I remember that I joined beginning of 2018 to work in your team, and really enjoyed that time. I think we collaborated in a lot of different projects together, and I also need to say, we collaborated together at a previous company, and I was very excited to now have in this new role the opportunity to also work on more IT or software solutions, as you described before, with you. And with time, you build trust, and based on trust, it's then also easier to openly communicate. And I really appreciate that. It's then easier to also challenge ideas constructively. And of course, with a common goal, always keep in mind. And it's basically it.
Great. Thomas, anything to add?
I couldn't agree more. So that makes sense. If you have such a long-term relationship, many things are easier. You also, of course, you need to be sometimes careful that you do not, or you always do only those things that the other person likes. That is the case for Nils. He should object if he doesn't agree, and my job is also to ask for things that maybe are not the ones that are the easiest, but at the end it helps, of course, to work in such a long-term relationship with each other because we know each other, and based on our culture, I think we are also able to talk openly to each other if we don't agree with something. Yeah.
It's great. I completely agree, and it makes the work easier, I think, when you have those relationships, and also makes it more efficient. You know how each other work, and you know what the common goal is. So to get to some of the details of what we do at GPAM, so how would you describe GPAM's core strategic services in strategic consulting in just a few sentences?
That's quite difficult, right? But I try my best to give it a shot. What we offer at GPAM is not really something we would call dossier writing, even if we do dossier writing specifically regarding NICE and the new GCA, the European HTA. What we do is to start very early in the process. So we offer strategic services that typically start to be delivered 4 or 5 years ahead of market approval. And that is then understanding value propositions, developing evidence generation strategies, and then afterwards implementing them if there are evidence gaps. That also includes more HTA payer-driven discussions on trial design. And I mean, it's an open, not even a secret, but an open secret, I would still call it, that most trials are designed in a way that the American FDA likes them, but then there might be deviations in terms of European requirements, and that might mean you need to maybe to change the design, or if that is not possible, to think about other ways of evidence generation. So that is what we do. And if you would ask me, what is now the thing we do? Well, I would say 3 things. First, because this is strategic work, it still there are parts that need to be done, like reviews of previous HTA or regulatory decisions. But this is really seniority driven. So we have internal experts like Nils and like myself, or even you, Maria, who understand what is behind a value story. So that's the first thing. So the second thing is, if needed, we have a network of external experts in practically every major country. So, and if needed, we can involve them at least for validation of plans and concepts we developed. And then the third thing, and that is rather new, and I already mentioned that, what we try at GPAM is that we try to use technology in areas where it makes sense to use technology. It's not that we say strategic services can be provided without humans. That's not the case. But where it makes sense, we try to use technology to make ourselves more efficient and to help clients to achieve their objectives. And I can talk a bit about that a bit later, but these are the 3 pillars, I think: internal experts, external experts, and technology that supports our strategic work.
You can tell that you've done it for a while, because there is this process and system, both with the experts and the network to validate the work that you're doing, and now this innovative tool. It sounds very cohesive, and there is a process that clients can access straight away, which is nice to hear. So I think you pointed to this a little bit earlier, but what are some of the most common challenges clients face when they come to you and require strategic services, and how do you help them overcome this?
So I think one of the biggest challenges our clients face is sometimes evidence generation is not just about just executing a data analysis or planning how to collect a specific type of data. there is a strategic element to that. So it's important to understand the different perspectives internally in the organizations of our clients, because it also involves then strategic alignment between different functions. And to some degree, this is also a political challenge, if you want to say it like that. So clients frequently come to us with a sense of urgency because obviously, as Thomas mentioned, they need to meet specific timelines in order to ensure access. And obviously, they need to, in order to do that, satisfy regulatory and HTA requirements in order to convince not only clinicians, but also payers, so health insurances, to pay for their products. And that requires to have a completely aligned evidence generation plan in place, which not only incorporates clinical needs, but on the other end, then also payer needs and obviously patient needs as well, in order to be successful when it comes to the time of market launch. And what many people might not immediately realize when they talk about these things is that a big part of our role in helping to build this evidence generation plan is to also navigate through the strategic alignment process, so the internal alignment process which happens at our clients' internal organizations. So in that regard, it's really about how to support the product's value proposition to ensure that everybody at the organization has a clear understanding why a specific study is conducted and what is the overall goal and how it supports then the market access at launch, and specifically what kind of perspective it would address. And in that light, it is of specific interest here that there is not only this cross-functional dimension, but also multi-national dimension. So across different countries, there might be different perspectives on these kind of questions. And with a new European Joint Clinical Assessment Program, for example, in the European HTA space, there is now like an active need to align these specific HTA needs on a cross-national level. And this obvious shift makes it even more necessary for our clients to be forward-looking when it comes to evidence generation planning and have already some scenarios in mind when setting up the clinical trial design before then thinking about supplementary activities like observational studies, literature reviews, meta-analysis, etc. So that kind of questions we try to tackle here.
And so what would you say then makes our approach unique compared to other companies?
I already talked about that a bit, but I would say every company obviously would claim we have experts both internal and external. So if you would ask me, well, what is really unique, then it is indeed probably that we combine humans with technology in a unique way. And I already mentioned that, and maybe it's easier that I just show it. So we developed a tool that is called Navigator. It's not a demo today for Navigator, but that tool supports evidence generation plan development, execution of evidence generation plans, and that's an example. Also supports PICO simulation and consolidation in preparation of the European GCA. And just to give you an example, so and that is work so far that is done in most companies by most consulting companies using Excel or other usual tools. And we developed a tool for that. So if you look, I could, whatever country we are interested in, like France, and then I could create a new PICO. I will not do it right now, but I could add the right population based on certain criteria. Then later the intervention, the outcomes, and the comparator, of course. And then what is nice about that, once I have done all this, I can generate nice reports. So I can generate nice reports regarding what is my PICO list. The tool supports that by providing information on which population is covered. That helps me in prioritizing the PICOs. There might even be PICOs where I say there's an evidence gap. I don't care about these PICOs. That's also something that might happen. And I can even add, and that is nice, I can even add evidence. So if I have studies like an ITC coming from our anchor tool, or a real-world evidence study like a synthetic or external control group, I add this evidence here, and then the tool generates per PICO, per country, an overview about my evidence status. And that is what we mean by technology. Technology doesn't mean that it does all the work that is needed. It just supports us in our internal work and what we do. And that is really unique, I think, if a client now approaches us to support the organization by developing an integrated evidence generation plan, or by doing or supporting the PICO simulation. We do that, but provide the respective result also as part of Evigator. And then clients can take over that and work with Evigator to execute everything. And that saves time and makes internal communication a lot easier. Every client can, if he wants, assign 200, 300 global and local stakeholders to Evigator, and then everyone can have a look on how the plan looks like, what the PICO portfolio is, what the status of evidence generation is. So that's what we mean by technology-supported strategic services.
I had a very complex project a few years ago where Evigator would have really helped, because the client had a single-arm trial. There was different evidence for different populations that we had to draw together for different dossiers. So I really wish I had access to that a few years ago.
And sorry for that, but to say that, I know clients, global clients, who tell me we spend 30 to 50% of our time on informing other internal colleagues on the status and the plans. And the local stakeholders often tell us, if we had known that this study had been planned, our local evidence generation plan would have looked like differently. So sometimes it's these simple things, but the simple communication topic, provide a tool where everyone has access to the same information, up-to-date information on what's being planned and what's being executed. That's one of the driving ideas of Evigator, to be honest. Yeah.
Right, and I can see how it overcomes the challenge that you were speaking about, Nils, which is internal alignment, and sort of having that organized tool seems to really overcome that challenge. I mean, can you give a real example of how the technology has impacted a client and supported a client?
So, I mean, we already mentioned JCA, and we need to now really prepare in a very short time for this PICO assessment. And I think that's a perfect example where Evigator can come in and foster alignment between different teams and also between local teams. Not only to make the process to define the evidence needs in each country more transparent, but also to develop a more standardized framework for this process. Because what many companies still lack is like a standardized structured framework that helps them to plan their evidence creation. So with Evigator, we can now bring together the different disease areas, treatment settings, geographies, and regulatory landscapes, not only in terms of PICOs, but also in terms of other evidence generating activities. I already mentioned observational studies, literature reviews, but also ad boards or patient surveys. All of these kind of activities often the other teams, they are not aware of what is going on within the organization, and bringing these together in an integrated evidence generation plan. And I think that is the term most of our clients now use these days, is really important. And Evigator brings to the table a structured framework how to do that. So they can go through our questionnaire, address question by question their evidence needs, and understand what has already been planned, what is already ongoing, and where are specific aspects in the evidence generation strategy which have not been discussed internally yet. And by going through this process, we hope to help to integrate different study designs from different teams into one common template, which obviously is a bit challenging because clinical trials, real world evidence, sometimes these kind of designs can look very different from each other, but we try to design Navigator as intuitive and practical as possible in order to make it easier for the different backgrounds to understand what is happening in the different departments. So it is mostly designed to simplify coordination efforts and to integrate the different study designs into one common data-driven strategy, which is then aligned for engagement with payer, with regulatory stakeholders, and lastly also clinical stakeholders.
Great. So what excites you the most about the future at GPAM?
So to me, it's really about how clients will react to the new software solutions we have developed. It's not only Navigator, but in the strategic space, it's really of interest to me how to see how they will use it, specifically also in the context with JCA, because we still don't know what it actually means in reality if specifically also organizations fail to meet these requirements or simply decide to ignore some of these. And this will, I think, very interesting to see and important to understand also what that means then in terms of implications for market access and later pricing and reimbursement discussions, specifically in the European field. And hopefully Navigator can play a positive role here and make internal alignment processes more efficient, shape the way how they communicate internally, and most likely make the evidence generation strategy more transparent to everyone within the organization. And I want to support that way.
The JCA has certainly made our jobs more interesting, so it's come at a good time to also need solutions and technology solutions. Do you have any final thoughts then or messages for potential clients that are considering working with us? What would you like to say to them?
I mean, that's first, it would be very nice if they are considering working with us. That's already first good news. My final recommendation would be come to us early. Think about timelines, because evidence generation takes time. Good evidence generation takes even more time. And we might need, in some cases, years to generate some evidence. So start early with strategic thinking, then make the right decisions, and then follow a plan. And the plan then also includes a market access process that now is not over with one decision, but takes years probably. I mean, if I just talk about the European, we have now the GCA around regulatory approval, and probably the last HTA and payer discussions 4 or 5 years later, which means you need to keep your evidence and all the results based on evidence, like ITC results and so on, you need to keep them updated or renewed. You need to include then real-world evidence and so on. So time is really an issue. And to come up with a good plan, it makes sense to start with strategic thinking quite early. So ideally, clients, please come to us 3 to 5 years ahead of market approval, and then let's start strategic thinking. That would be my recommendation.
Great. Well, it's been a pleasure knowing more about our strategic services, and look forward to seeing more from Navigator. So thank you.
Thank you.
Thank you very much.